cities moving to restrict vaping. Citing public health risks, New York is banning vaping in public indoor places, which is already the case for traditional cigarettes. The new law, following a host of similar regulations tied to e-cigarettes across the nation, kicks in next month after Governor Andrew Cuomo signed legislation Monday. These products are marketed as a healthier alternative to cigarettes, but the reality is they also carry long-term risks to the health of users and those around them, Cuomo said in a signing statement. This measure closes another dangerous loophole in the law, creating a stronger, healthier New York for all. Vaping is now prohibited in New York restaurants, bars, and other indoor public places like workspaces. The measure does not apply to people who want to use e-cigarettes in private homes, hotel rooms, or retail tobacco stores that permit smoking. California, Connecticut, New Jersey, and Utah are among a growing number of states that have similar regulations. Countless cities across the nation have also adopted similar rules on electronic cigarettes. For a deeper dive on nationwide regulations, read this data from the Public Health Law Center. There are all sorts of e-cigarettes, also known as vaporizers. One style has a powered atomizer that is activated upon inhalation. Other types use a heating coil that is switched on by the user. In all the devices, liquid nicotine or other products in a cartridge are heated, become vapor, and are inhaled. Nicotine content varies by product and maker. The devices can also be used to smoke marijuana oil. New York's law comes 3 months after a federal appeals court upheld a President Barack Obama-era regulation that barred e-cigarette smoking on both inbound and outbound U.S. flights. All the e-cig regulations sweeping the nation are based on health risks. It's a growing industry that the Centers for Disease Control and Prevention says is valued at $2.5 billion a year. The U.S. Surgeon General in December declared vaping products a major health concern. A sufficient body of evidence justifies actions taken now to prevent and reduce the use of e-cigarettes and exposure to second-hand aerosol from e-cigarettes, particularly among youth and young adults, according to the report. Most important, many health risks are already known, and sufficient information exists to take action to minimize potential harms. The evidence is most compelling for nicotine. British health officials have said that e-cigarettes are 95% less harmful than traditional tobacco cigarettes and are preferred over regular cigarettes.